Jeff.
Good morning.
Good morning.
Good morning. Good morning.
Mhm.
Hey, guys. Thanks for being here.
Always a pleasure. Mhm.
Absolutely.
Yeah, I was hoping to get on earlier with you, Doc, and talk about how to maximize our efforts on the headache series that we're contemplating.
Yes. Yes.
So, but here we are on time at least.
Indeed. Indeed.
Um, we're going till about 11 today. Is that the
Yeah,
plan?
the show is longer than that, so we have time. It's
Okay.
really a matter of how much time you have and would
Okay.
like to spend. It's but the show is usually 90 to 120 minutes typically.
Okay.
So, but we're super flex. I understand you're probably in the middle of a patient day.
And I'm in my recording time. This is my recording time of the week.
Oh, good. Okay. Well, I'm glad that worked out.
But yeah, yes, I have an hour today.
Okay. Excellent.
We'll set up
That'll
another time to brainstorm the future
yeah,
then.
happy to. Yeah. Yeah, this both you and Jeff will be doing companion courses for your books, which is
Oh, nice.
helpful,
Yeah.
really helpful.
Jeff has good things to share. I enjoyed his
Yeah,
book as
you
well.
both do. Yeah, for sure. All right. Well, I think we are queued up. The tech is sorted. Dustin will be along at some point, but I'm gonna get started.
Yeah, we just finished recording a podcast an hour
Oh,
ago.
excellent. Oh, nice, nice. All right. Well, good. And we are set. Okay. Well, welcome everyone to Mondays with Michael on Natural Health and Health Freedom. I'm Dr. Michael Gaeta, your host. So glad you're with us today. We are streaming to about 10 different pages and platforms. So, whatever platform you're joining us on, we'd love to hear from you. If you'd like to introduce yourself and anything on the subjects that we cover on natural health and health freedom, we'd love to hear from you. So, don't be shy. You can put right into the chat on whatever platform you're on, anything you'd like to share with the group, and we love to hear from you. So today we have a wonderful show planned, really special show today, which I'm been really looking forward to. And this is our weekly show and podcast on two subjects of natural health and health freedom. And this is an offering of the Gaeta Institute. Our motto here, as with the Clinic for Chinese and Functional Medicine, is nature first, drugs last. Again, drugs aren't bad, they're just ridiculously overused, and there's a natural solution at least 95% of the time. That's a low estimate.
Mhm.
So this is a warm welcome oh, we've got a Zoom freeze. Sorry about that. It's a live show, so stuff happens sometimes. And we're going to get that back up for you. Okay, here it is. So, right, kind of like Saturday Night Live a little bit, so stuff can happen. So welcome to show number 298 for this January 5th of the new year. This is our first show of the new year. We are starting with a bang. Actually, no, it's not January. It's the 12th. Sorry. It is still it's the second show of the year. I forgot. Well, you know what? That's embarrassing. I'm going to go change that now and put a correct date up there. I'm like, wait a minute. It doesn't feel like the 5th. Anyway, there we go. So for our second show of the year, and we are starting the year off with a bang here in January with an epic group of guests. We usually have 0 to 1 guests, and today we have 3. I am honored to welcome back to the show. They've all been on previously at least once. Dustin many, many times. We have all 3 are current or soon to be Gaeta Institute faculty members here at the school. joining our roster of 26 faculty that we currently have. And we are just delighted to have them join our teaching staff. So you're all familiar with Dustin Strong. Many of you will remember Dr. Jeff Crippen and Dr. Scott Verzal. Dustin Strong is the founder of Strong on Health and Strong Seminars, which we're going to hear about later. He is a board-certified holistic nutritionist, applied clinical nutritionist, a lifestyle health and wellness counselor, and one of our most popular Gaeta Institute faculty members with 8 courses under his belt and more on the way this year. We also have Dr. Jeff Crippen. He is a chiropractor, a nutritionist, and an author of a wonderful book I'd encourage you to get. Was really helpful for me in clarifying my thinking on these subjects, and I learned a bunch myself. His book, Timeless Youth, and he is found at Crippen Wellness and timelessyouthbook.com. Dustin is at strongonhealth.com, also a fellow musician. And then we also have Dr. Scott Verzal. Both Scott and Jeff are licensed chiropractors, doctors of chiropractic. Dr. Scott is an advanced applied kinesiologist, an educator, speaker, like Dustin, a competitive athlete, and Jeff as well. He is the author of The Headache Advantage, 7 Pain Patterns as Tools for Total Body Transformation. I highly recommend his book. And a little preview, later this year, we will have a course on this subject of the headache advantage. And you can find him at Dr. Verzal, VRZAL.com. So as always, if you are on our watch page at michaelgaeta.com/watch or in our Zoom link, we'd love to hear from you if you have questions, as well as comments and anything else you'd like to share. So with that, we have a very important subject today, which is something I've been speaking on for the last 25 years and is personal for me because my dad passed away of his second heart attack 20 years ago in 2006. And I was already kind of deep into cardiovascular and what we now understand as cardiometabolic health. But, holding my dad's hand as he passed away of his second heart attack in December of 2006 was, obviously devastating. And when the tears dried, I came out of that with a renewed, amplified commitment to really understand this area of cardiovascular disease and cardiometabolic health. And we have 3 leading experts on this subject with us today. And we are going to be talking, we're going to do a deep dive today. You're going to learn a lot that's going to be extremely helpful to you and your family. And we have a lot of practitioners that join us on the show. You're going to learn very specific things to help your patients as well. And you're going to learn about an opportunity coming up at the end of the month to do a much deeper dive on this incredibly important subject of cardiometabolic health. So our format today is each of our guests today is going to share an idea that they have found helpful with their own patients in their own clinical practice. And then all of us will have a chance to add and contribute and comment to what they have shared. And if you're on our Zoom link or if you're on our watch page, we will be taking your questions. This is a big subject. It's the number 2 cause of death in the United States after our medical system, which is number 1. And it is one of the 2 leading causes of death, kind of flip-flops back and forth with cancer worldwide. So this is a very important subject, and I'm just going to start us off with a short, just to understand, we're using this term cardiometabolic. Well, what is that? What does that mean? Well, cardiometabolic syndrome is not a disease. It's a group of risk factors for cardiovascular disease and diabetes. So it means you have at least 3 of the following issues: high blood pressure, insulin resistance, central obesity, high triglycerides, and low HDL. So you've got to, if you have 3 of those, and by the way, that's at least 60% of American adults over the age of 60. So most adults over 60, and I'm kind of guessing it's over 50 at this point, have this syndrome. So what we're sharing today is incredibly important and very relevant. And we are going to lead off today. I'm going to bring all of our, we're going to bring our Dustin. We're going to start us off today. Welcome, Dustin. And also, before we do that, just wanted to bring on the screen here Dr. Verzal and Dr. Crippen, so you can all see everybody. And just a warm welcome to you, beloved colleagues, and thank you for coming back to the show for this incredibly important subject.
Thanks for having us. Yeah, excited. I think this was born out of the fact that we're all going to be together at that seminar on the 31st.
That's right.
And this is most of the expert panel that we're going to have at the end for the panel discussion for everybody to kind of ask us questions. I do have one surprise addition to that I'll tell you guys more about another time. Flying in from Australia to be on that panel.
Wow.
So yeah, that'll be pretty cool. But yeah, I think that, I mean, the inspiration is we've been talking a lot about this polypharmacy situation being more and more increasing fatalities, I would say, mortality in a lot of people. And the more we can talk about what people can do to take control of these things and not just fall into the pattern of accepting that you have to take all of these medications is, of course, what we're all here to do. And more and more, I'm seeing so much confusion being handed to people. My classic story is a lady who in her 70s came to me and she was on multiple blood pressure medications. As she got healthier, her blood pressure was dropping dramatically. I mean, very, very low. She was alarmed by this. She called the office and said, "Hey, what are the things that you're giving that's causing my blood pressure to go low?" So I, of course, said, let's look at those medications. In finally having that conversation, she was on a beta blocker. She was on a water pill. I encouraged her to call her doctor and let him know what was going on. And he just told her to take her water pill every other day instead, which I just isn't enough, right? This is a person on a beta blocker. But when she did take the time to look through all of the negative aspects of taking a beta blocker, it really was a huge alarm bell for her. But it wasn't enough to completely get her to do the things that she needed to do to completely transition off of it because of the decades of normalization of taking medications for these things. So it is a process, and I think together we all need to help each other figure out how to best communicate effectively to individuals without it being confrontational, without it being saying that there's people doing things wrong, but just that there's a new approach, that there is a shift happening, that there is a better understanding of, that there have been advances in this, and we're applying what we have learned in our clinical experience to the individuals that we get to work with, so that they can be in the future with us.
Yes. Yeah. That's great. So Dustin, you've seen so many patients in this area of cardiometabolic syndrome, cardiometabolic disease, who are looking for a natural approach. Just share with us, Dustin, if you would, just one pearl, one practical, here's something you can do that you have found helpful, just out of your massive palette of recommendations. What's one that you found reliably useful for patients who have this condition, or would like, or are relatively healthy and just want to stay well and prevent it?
Well, first of all, the number one thing, and we're talking about hypertension, correct? Because I saw that number one on the list.
It's a constellation of cardiometabolic syndrome. So this could be cardiovascular disease, diabetes, insulin resistance, central obesity, hypertension, low HDL, elevated triglycerides, anything in that constellation of what we call cardiometabolic, which is, in part mitochondrial dysfunction. Well, what have you found one of the very reliably helpful recommendations that you've made to your patients?
Well, honestly, in this vein, I can't say overall, but because of what we just started talking about, it's bringing their attention to the side effects that they should be looking out for when taking medications in any of these categories.
Okay.
The lack of awareness of the dangers of most of these medications is egregiously missing. And Dr. Verzal and I had an interesting conversation just previously with the doctor who was even saying she's offended by the term alternative medicine. She thinks that medications should be called the alternative, right?
Yeah,
To the true whole healing. And I love that she said
100%.
that.
Yeah.
And that's just it. I just actually got off a call with the UK, the BANT, the British Association of Naturopathic individuals. And the woman I was speaking to was on a medication for the last 12 years. And it has caused all of these issues. And again, it took a lot of pulling from her to get her to say, to look at the medication. Because people just, they get set on a medication and then just throw it in the back of their brain and they never come back to it again. And
that's often what they're told, like you're just going to be on this for life.
Right. So bringing the awareness, I think, is one of the most powerful things that I think, because it opens the conversation and letting them know that just because you were in a situation that was given, you were given this medication 5, 10, 15 years ago.
Right.
Okay, well, how are we respecting how the conditions have changed since?
Yes.
And what is the conversation with your doctor about the fact that things have changed? And for goodness sake, we are moving rapidly towards more and more information and understanding things. We should absolutely be respective of the past, but also understanding that when the conditions change, we should be changing the questions we're having with our doctors and whether or not it's still appropriate, right? We can't say that, with something I took 20 years ago helped me feel good. The conditions in my life have changed dramatically. I can't say, oh, if I do that again, I'm going to have the same result. That's it's really foolish.
So that's a big pearl there you're dropping there, Dustin, is that a lot of folks take medications, assume they're safe, assume they're not causing any problems or side effects. In my experience, I've seen a lot of cognitive issues with folks on antihypertensives, for example. So in your practice, where do you recommend patients go to learn more about their meds?
Well, that's a good point. I don't tell them. I try not to tell people what to think or it's about how to think. I think Dr. Verzal said that many times, probably Dr. Crippen too. So it's about just having them find it on their own, because 9 out of 10 times you will tell them, go to this website, look at this thing, read this, and they're going to come back to you a month later and say, hey, did you ever hear of this? Right. So they forget entirely that it was you. When they discover it on their own, they own it so much more. And then they're more apt to share it with other people. So I want them to have that victory. I want them to be able to find it. Hey, search these things. Look for these types of things. Check in just type into a Google search your medicine and side effects, right? Or warnings, and just let me know what you learn.
That's great. I'm going to go over to Dr. Scott Verzal. Anything you'd like to add to what Dustin said from your clinical experience?
Tons. Our best practice management is to help keep people alive, right?
That's right.
Certainly easier to grow a practice if they're alive.
Right. Yes, that's right.
And help them make babies and keep them alive. But
I've
often
often
on the med
said
thing,
that the drug companies want folks to be sick but not dead.
Right. And on that drug front, to kind of tee up or follow up with what Dustin was saying, I like to kind of tee up the conversation with, when your blood pressure starts going too low, or you start having these symptoms of cognitive, memory recall challenges, getting dizzy when you stand up too fast. Blood pressure is an easy thing to measure. Jane, are you tracking your blood pressure at home? When your blood pressure starts getting too low, here's the win. You're actually over medicated. Huh? So now your things you've been doing, the changes you've made are lowering your blood pressure, and you don't need as much medication. So then they can self-regulate. They can start reducing their medication. Then it's an easier discussion with their MD, because they now say, look, my blood pressure is 120/80, and I've only been taking half of my beta blocker, and I feel so much better. Then the doc is not threatened by that, what Dustin said or what somebody else, changed their protocol. It's the patient basically sharing their testimony, and we
Yeah.
can't argue with the testimony because that's the patient's reality. So it makes the
Yes.
conversation a lot easier and then the follow up to that is we celebrate. Hey, you're over medicated now. This is great news. You're
Mm,
actually functioning better.
right.
So it just kind of makes that conversation more manageable. Again, hate to say it, but doctors often, have pride in the way, and so if we tell them to take something to stop taking the medication or we tell them to change, and then that's converse to what the medical doctor has told them, then
Yes.
it's a pride battle. You're not doing what I said, and there's all that
Right.
threat.
Right.
It's so much
Right.
easier when it's simply a testimony of like I realized that I got dizzy when I was taking this medication, or I couldn't get out of bed, or I couldn't remember my wife's name. Then
Right.
then it's a lot easier conversation to reduce that medication. Mhm.
That's great, Scott. Yeah, I often ask patients, would you like to make the medications unnecessary or
Mhm.
less necessary? In other words, if you get better, you'll need less meds. Is that something you're interested in? Everybody says, well, of course, I'd love to be on
Right.
less medication. And my standard, thing that I do with patients, like for example, with just recent example would be your area of expertise, Scott, a patient with headaches who was taking Imitrex and other
Mhm.
medications. And I said, well, as you feel better, then go to your doctor and say, I'd like to be on less meds. How do I do that? And then the doctor sorts that out. That's a great point, Scott. Thank you. Over to Dr. Jeff Crippen. Jeff, anything you'd like to add to Dustin's recommendation from his practice?
Yeah, if I could share something, because I was thinking about this as Dustin was
Oh,
talking,
yeah,
and you were talking,
please.
Dr. Gaeta, on polypharmacy. So this was a study from 2007, and one we'll be going over at the end of the month. But what they did is they looked at a group of elderly patients and had some of their unnecessary drugs discontinued. Now, Dr. Gaeta, if I asked you which ones were unnecessary, you or I or Dustin or Dr. Scott, we might have a different list of what is unnecessary. But this was the medical doctors determining unnecessary. So they took them off 2.8
Okay.
drugs on average. And what happened?
Wow.
Their death rate dropped in half.
Wow.
They
Mhm.
Wow.
you live longer getting off 3 medications, right? So
Yeah,
when we're
wow.
talking about polypharmacy,
Yes.
um, and that's the yeah. So maybe the Israeli Medical Association in 2007. But
Yep.
I just love that study as just an indication of exactly. I mean, your whole philosophy, right? Nature
Yep.
first, drugs last, and as last as possible, right? Is kind of
Yes.
like
As
kind of
last
how
as
that goes.
possible. Oh, I'm going to borrow that.
Okay. Yeah, as last as possible. And this is saying, hey, the average elderly person, at least in this study, they were on, well, probably a lot more than 2.8, um,
Yes.
unnecessary medication because they got off the food 2.8 and their drug and their death rate dropped in half. So just
Mm.
that idea, how that related is that a patient come in on Friday and ran some routine blood work, and it was the high sensitive CRP, C-reactive protein, jumped up to 15. And it's like, so what the heck is going on? They had some eye issues that we've been working on for a month or two. And anyway, they live down in Mexico. They just flew in. So I was catching up with some blood work and seeing it in person for the first time in a few months. It's like, what the heck is going on? Well, I started working out. I'm doing some intensity training. Okay. Started taking Celebrex to
Mm.
help with the muscle pain
Mm.
post-exercise.
Mm.
I was like, what are we doing here? There was a black box warning put on that in 2004,
Mm.
right? That said it increased the risk for, basically sudden heart attack, right?
Mm.
And stroke. So anyways, so it's just a reminder that some of those drugs that, we think we've moved on from a while ago are still there. And it's important to be aware of them. To your point, Dustin and Dr. Gator, on that unnecessary drugs and just being aware of what those are. And vision problems, as I found out, were a side effect of Celebrex. It's one of the things it did. It was affect the
Mm.
vision, and kind of
Mm.
explained why we had a little trouble with it for the last couple of months. So anyway, that's my recent example. But get off your medications, cut your death rate in half. Welcome to our
That's
seminar in
amazing.
October.
Yeah, average American is on 4 meds,
Yeah.
and the average American fills 19 prescriptions per year,
Yeah.
Mhm.
which is just nuts. And those numbers are much higher, the older we get. I had there's a medical doctor here in Colorado who used to come to my local study groups for standard process. and he was in charge of public health for the city of Chicago in the 70s. And there was a hospital strike, and he had a master's of public health, was in charge of public health for Chicago, and the hospital strike ended, and he was like, I wonder what happened to our mortality rates. Mortality rates went down 90% in Chicago in the 70s while the hospitals were closed. It's insane. And I was speaking in Pittsburgh one day, and lady raised her hand. She was a hospice nurse, and she said every week she'd been doing hospice care, in the hospital for 25 years. And she said just about every week they get a hospice graduate, meaning the attending or the supervising physician comes in and, patient goes on to hospice care, end of life care, palliative, takes them off all their medications. And she said about every week somebody goes home and after being on hospice care, after they were taken off their meds. And she said, I've been doing this long enough. I follow up with these patients. And she said they typically live for years after being on hospice. And not just like another few days. It's like they're alive 5, 10, 15, 20 years. So it's kind of amazing. So we're going to head over to Dr. Verzal. And Dr. Verzal, cardiometabolic syndrome, something I know you see a lot in practice, as we all do. What's something that you found incredibly useful for your patients as a reliably good thing to do to either address or prevent?
Well, tying it back to headaches, just because there's a book behind me about them.
Yes.
I mean, the right-sided headache is a gallbladder problem. The neurotransmitter that drives the gallbladder is acetylcholine. Acetylcholine is the precursor to nitric oxide. So when we have elevated blood pressure, one of the potential triggers for elevated blood pressure is bile stasis or congested gallbladder. And so we can look at some of the potential triggers there to stabilize acetylcholine, to allow the vessels to function, to dilate properly, allowing proper circulation, keeping the blood pressure type of headaches down, keeping blood pressure down. As we were talking, I was reminded of the conundrum in the medical model with blood pressure is they typically give a person a medication and say, well, that didn't help. Keep taking that one. Now let's try the next one, right? That's how they end up, with 2.8 unnecessary medications, right. Because they've tried 4 different blood pressure medications to finally get their blood pressure down, and they kept them on the first 3 that didn't make any change. So, I mean, we could be taking medications. We can be eating tomatoes. Tomatoes, incidentally, cause acetylcholine to go low. Acetylcholine is a neurotransmitter of recall. You talked about memory problems. So, things like tomatoes, or then we've got the glyphosate. Sorry, my screen changed. Okay, you're just pulling it up.
Oh, no problem. I'm just letting folks know about your book here. And the link is
thank you.
Yep.
Thank you. Appreciate that. So acetylcholine is the precursor to nitric oxide. Things that can compromise that, the glyphosate in wheat, corn, soy, and oats, that inhibits the bile, the gallbladder again. So we want to limit wheat. That could potentially cause, literally brain damage. There's studies that show MRIs with the white plaquing masses in the brain that actually shrink and go away when they cut the wheat out.
Right.
Now, we talked about, one of the more common surgeries in the U.S. is gallbladder cholecystectomy, cutting the gallbladder out.
$50,000 a month.
Right, that's a lot of business.
That's right.
And so if the gallbladder's been removed, we need to replace bile on a daily basis because they don't have the storage mechanism anymore. But again, the headache advantage, the advantage of head pain is it often tells us the priority for a person. So if they have a right-sided headache, then it's likely a nitric oxide concern that's causing their blood pressure to elevate or to go up.
Right.
So that's one. You said give you one pro. I guess I'm a giver or I'm greedy. I was going to give a couple, 2 or 3.
You've got so much great information to share, for sure.
So the other headache correlation with some of this is the frontal headaches. That correlates with the high cortisol. High cortisol causes with chronic cortisol, we end up with norepinephrine deficiency. Norepinephrine is gastroprotective. So think this is basically the ulcer pattern. And so
Right.
if we're in that chronic stress cycle, then the stomach lining becomes kind of eroded, if you will, and that sets up the frontal headache pattern. So if they have that, the typical sign of a headache, hand on their head type of thing, then they're in that chronic stress cycle. Potentially it's the sulfation pathway in the liver not breaking down that cortisol properly, or they're just in that not managing life, not getting those Sabbath days, that appropriate rest and balance in life.
Right.
So they're stuck in that chronic cortisol cycle, like most of the people in my area, probably in most of yours as well,
Yes.
are in that stress cycle, sets up chronic cortisol. Serotonin goes up with that. Then we've got the constricted vessels, elevated blood pressure in that situation. So that's how a couple of the key headaches may play into or help us understand why blood pressure is high, so that we don't do the medical approach of, here, take this drug, that didn't work, you keep taking it, take another drug. Let's look at why they needed that in the first place.
That's great. Well, what I'm hearing there, Scott, is that the contributors to certain types of headaches are also the contributors to certain aspects of cardiometabolic syndrome and cardiovascular disease.
True. Yeah, and we can use any pain in the body, kind of like the chart's trying to depict. But those pain, if our car's wise enough to tell us when the tire pressure's low, or the oil's low, or the engine's not running right, the body's a whole hell of a lot more intelligent than that. And it's giving that information. Unfortunately, most doctors, most people just don't know how to read it, don't know what the sign is, the warning is there. So again, remember, pain is your warning sign. It's that warning light on the dash that something is amiss, something's not working right. Keep working that. If it's intermittent, that's a blessing, because then you can at least journal to what you did different when the pain was worse, whether it's a headache, a knee pain, blood pressure. If it's fluctuating, there's something in your life that's different on those periods.
Excellent. Thank you, Scott. That was a lot. I'm going to have to re-listen to this and take more notes. That was excellent. Thank you for your technical depth. Appreciate that. I'm just going to go over to Dr. Crippen. Any comments or additions to what Dr. Verzal shared there on this subject?
Oh, I'll add what I loved about it. One thing I loved about it is something you mentioned at the headache seminar that we were at in October, that you were teaching in October, Dr. Verzal, which was that connection between glyphosate and gallbladder function, right? That glyphosate inhibits gallbladder function. So going back to your stat, 50,000 happening. Was it every month, Dr. Gaeta?
Yeah, we chop out 50,000 gallbladders a month in the US.
Yeah. So what's behind that now? Well, I think that glyphosate gives us a real picture into what can be going on with that. And what I heard you say new this time was, or you probably said it before, but I heard it this time, was that then inhibits the choline, or so that the choline that the lack of the choline then leads to lower nitric oxide production. So if we look at the need for that with the elevated blood pressure, now we have too many Cheerios or Honey Nut Cheerios are number 1 and 2 sources of glyphosate, right? Too much of that leading to gallbladder issues, leading to compromised choline synthesis in the body, which then leads to low nitric oxide production. So I think that's a real powerful thing, as we're talking about, cardiometabolic health, and specifically that fits directly with elevated blood pressure. Anyway, I heard that again and differently this time. So thanks for that, Dr. V.
Excellent.
Absolutely. And think what's the favorite food for that is beets, right? Beets are a known nitric oxide balancer. The beets are known to thin the bile, keep the gallbladder flowing. Correlation again.
Yeah. Oh, absolutely. Yeah. Beta food works for both, or whatever our favorite beet product is. Yeah.
That's great. And over to Dustin for commentary on Scott's insights.
Well, to piggyback on what Jeff just said too, before I get into that, I personally had 2 family members had cholecystectomy in the last couple of months. And they just, they weren't embracing that glyphosate connection and all the other things that do with it. And I've always, looked at research. I know it's like 700,000 a year has been the average. It sounds to me if this number might be going up, right? So it's getting worse, and that makes sense. because we're getting more and more inundated by this glyphosate quite a bit.
Yep.
But to what he was saying is that pain is the messenger, and using that as your teacher, right? Teaching you what course corrections you need to make in your life. I think we can also expand on that to say, if you're taking a medication and it seems to be working in any way, we can use that as a teacher as to help us course correct in our life and understand what we need to do differently.
Yeah.
And so I've always done that with the mechanism of action of the different medications, whatever it is. Okay, this is what it's trying to do. Let's learn from that and figure out how we do that without the side effects, right?
That's
so that's kind of, like I think Dr. Verza jokingly called it the high blood pressure advantage as well, right? Instead of the headache advantage, it's the whatever it is advantage, because it is. Yeah.
That's excellent. Thanks, Dustin. And we're going to head over to Dr. Crippen for some insights from your practice, Jeff, on this subject of cardiometabolic health.
Well, I'll tell you something that was actually inspired by a presentation Dustin gave to a small group of us online. Dustin was talking to us about. Yeah, absolutely. Yeah, and I think actually connected to, this is part of a course I think he did for you as well, which was Dustin was talking about the coronary calcium score, right? Looking at that number, and and then I think I heard him talk about it, and I think Dr. McCullough with you, Dr. Gaeta, talked about that as well. And one of the things I heard that was interesting was, we know the best number is roughly 0, your age, and that is kind of acceptable. And then 1 to 400 is kind of intermediate. Then over 400, over 1,000, you kind of hit these different buckets where your risks are getting worse and worse. So I got a call from a concerned patient was newly married, in their husband's in their 70s, and just came back. Coronary artery calcium score was 2,000, and they were freaking out. Right. And one of the things I was able to have a conversation with them about is, we talked about how can you lower that. So we talked about the omega-3 index, lowering risk of sudden cardiac death, 40 to 90%, depending on the study. We talked about buckwheat and rutin, and that article out of Harvard showing that it's the best thing that inhibits thrombus formation that they found in arterial and the venous system. But then also talked about, there's some number, and it's typically over 1,000 or 1,500, in which case that calcium score, it's not all in the intima layer of the artery, which is the most dangerous. It has to be by definition in that intermediate layer, which is definitely not good, but also not end of the world situation, right? At some point, that number is less bad, or at least it's not infinitely worse. It's not twice as bad as 1,000. Like 2,000 isn't twice as bad as 1,000. A couple kind of pearls I found on we were talking and spitballing about what we can do for an elevated coronary artery calcium score. So this was vitamin news, probably in the 40s, right? Deficiency of vitamin F. Whole food vitamin F may cause calcification of the coronary arteries with attendant angina pectoris. On the slightest exertion, the victim is seized with the most excruciating pain in the chest.
This is
it's no coincidence that vitamin F is proved the most useful vitamin remedy in this condition. And then he goes on to say vitamin C is also useful. So that's Vitamin News, Volume 8, 225. And one other fun thing from that is fast food. Talks about it for angina pectoris. But one of the things that goes here, it dissolves the calcium carbonate responsible for the calcification of the coronary arteries. That is usually the primary cause of this condition. So going back to angina pectoris. So there's some other things we can do, but we're definitely having a story of get off your synthetic calcium supplements, right? Stop eating limestone for fun or for health and a misguided view of health, right? Say no to limestone. Right. And then we can begin to build a program for someone like this of some Cataplex F, maybe some whole food vitamin C, which would have that capillary strengthening vitamin P fraction that Alfred Szent-Györgyi won the Nobel Prize for, in part in the early 1930s. And then we have the F as well. So anyway, that's the piece that I've just had a recent conversation with a patient that I wanted to bring up and share, because I think there's some really powerful ideas there. And some of it was discovered roughly 80 years ago, right? So we're slowly and surely catching up.
Right. Yeah, that's a great point. And, I was not aware of that F connection. We always think about E2 as to conserve muscle oxygen, but that F connection is excellent. That's
Yeah.
great. So those are some insights from your practice that you found helpful, Jeff.
Yeah.
That's excellent. So we're just going to head over to Dustin. Anything you'd like to add to what Jeff was laying down there?
Well, this is definitely something we're going to get deeper into in the seminar, is that coronary artery calcification, right? The contributing factors, the upstream healing of it, everything that he just talked about there, for sure. The only thing I would add to it is just considering, once you've got the things mobilized, right? If you're taking that calcium carbonate and you are bringing it back into solution, now where do you want to put it? And that's where that F, I think, is so important to get back into the tissue. I can't believe the amount of people that are struggling with viral issues, just did low tissue calcium.
Yes.
But, also we do want to get some back into the bone, right? So that's the one piece that I talk about a little bit more, is also the K2, which you see a lot of that out there. You see the D3 plus K2,
Yes.
which is such a portion of the conversation, but it's not the whole thing at all.
Yes. Yes.
So that's why, yeah, it's so great to have holistic minded individuals like yourselves to be able to really say, okay, yes, we're on the path, but we're not all the way there yet, right? So let's not stop here, because that's not good enough.
Yes. Excellent, Dustin. Thank you. And Dr. Rizal, anything you'd like to add to what Jeff was sharing?
Well, just as he was talking, I wanted to look up the prevalence of cholecystectomies in the European countries, because they use far less glyphosate.
Interesting.
And once the stat I just came up with was 19,000 a year
In the whole
Europe.
continent? In the whole continent? Oh.
So,
Wow.
I mean, there's epidemiologic studies, if you will, to look at potentially the consequence of the glyphosate on the gallbladder. Then to kind of tee off with Dr. Crippen's great insight, C, phosphorus, those all help methylation as well. Methylation is a heavy player in the cardiovascular risk. All the stuff we're talking about, the fragility, the weakness, and the calcification, if you will, of the arteries, often it's the metabolic marker we can use is high homocysteine. Homocysteine is broken down in sulfation and methylation. So the things we're talking about to keep calcium in tissue where we want, or in muscles and bones and where we want it, and not floating around the arteries and plugging up the arteries. The simultaneous conversation is keeping homocysteine down, which means keeping methylation functioning properly, keeping sulfation properly. So physical signs of high homocysteine are the red petechia, the cherry angiomas. Those are a sign that homocysteine is not metabolizing properly, and a risk for cardiovascular problems. So if you see those, or you see those on your spouse, especially when they start being mole size, when I taught about this 20 some odd years ago, this doc says, oh, like this, kind of showed her chest, and she had a, full mole size red cherry angioma. And I said, family history, stroke or heart attack. Yeah, both my parents died in their 40s of cardiovascular, compromise.
Wow. Wow.
So really, the bigger those are, the more profound, typically the higher homocysteine is going to be in that patient's life and that person's life. So, I mean, seeing them develop, I've had a lot of patients where they, kind of an explosion of those. It's like, the panic is practice management. I want to keep you alive for a little bit. Let's get that homocysteine metabolizing properly, which means looking at things to facilitate methylation. Beets, wouldn't you know, again, help drive that methylation pathway, the betaine, but keeping the toxic metals out, certainly they're a compromise, which again is another thing to help with, bones or mineral storage. So we keep the minerals status proper, then that's going to help keep the risk of cardiovascular problems down, keep osteoporosis managed. So yeah, the pearls, we're all sharing. There's so much more, we're kind of scratching the surface.
Oh, for sure.
But,
Yeah.
I mean,
Yep. Yeah, that's excellent. And and folks are going to find out more about this subject. We're going to get into the upcoming seminar, but I want to make sure folks know about Dr. Crippen's book, Timeless Youth, which I really enjoy. We've got links for you in the chat. But what a great book. The 5 Truths of Transformational Wellness and Holistic Healing. What a great book. I've read it. I loved it. And I think you will too. So please take advantage of that book as well. And sneak preview, later this year, we're going to have a course based on this book. with
all right.
even more insights, more updates, more practical application. If you are just a health conscious person or a clinician seeing patients, you're going to find a lot here in that upcoming course. So that gets us to an important announcement, which is an upcoming seminar, which is coming up later this month. And we are going to be interested in your questions. We've got this incredible group of clinicians here. So if you have questions, just put that on our watch page at michaelgaeta.com/watch or on our Zoom link. And this is a very exciting event. I'm going to be there. I'm going to be also participating in the panel discussion. Looking forward to that. And I'm going to turn this over to Dustin to tell us a little bit about this event that's coming up in just a few weeks to about, let's see, 2 weeks in Dallas. So actually 3 weeks in Dallas. And Dustin, what's happening at the end of the month?
Well, this is something we're trying that's new, right? In a way, because we're really trying to bring as much of a conversation together with all of these doctors. So it's 50 of us instead of just the 4 of us on this call getting together. Yes. But I wanted to make sure that we were able to bring a lot of different perspectives. There's a lot of brilliant speakers out there, but instead of me just being the one up there speaking, I wanted Dr. Crippen to come and have half of it so that they can hear it from a different perspective, his thoughts, his experiences. And then, of course, the panel discussion is something that hasn't been done at a lot of the seminars that we attended. So it really opens up an opportunity for people to have that true conversation about it. Going over a lot of cutting edge stuff. And like I said, as things are advancing, we're bringing the advancements. We're bringing not just the clinical advancements, but what's truly advancing, and a little peek into the future as to what pharma is bringing next and how we can get ahead of it so that we're not playing catch up when these things come into our office. And that's one of the worst things, is having somebody come in and say, hey, my doctor put me on this medication, and you're not aware of what that is. And then you have to, not be ready for it. And that's, we're trying to get everybody ahead of that, right? And already have the better understanding of things, and ahead of the miscommunication of what some of these labs are telling people truly, and really helping people understand that. But more importantly than that, let me tell you, this is intended to be a healing event for the healers, truly healing. And I don't mean to be picking on any of the seminars we've ever had in the past, but I always found it difficult to stand up there and talk about the importance of nutrition and the power of staying away from these foods, and then serving them the very foods we said to stay away from at lunch. So I was just on Friday meeting with the executive chef, making sure he was bringing me the foods exactly as he was going to, showing me in the kitchen that these are all certified organic foods, so that everything isn't. And one slipped through the cracks. I was telling Dr. V earlier, he brought out the lunch and he wanted to put some corn on there as a garnish. And I said, absolutely not. That is, are you kidding me? I'll be skinned alive if you put corn on the plate of these doctors. But we're really taking a lot of steps, and it is at a particularly higher cost. And I understand that's why it hasn't been done in the past. But to me, it's more than worth it. We can't, we have to make sure that everything that we're doing in this weekend is intended to support you and heal you as a practitioner. There's so many other things that we're innovating in this time. We've got some workshops happening on the Friday night before. Dr. Verzal is going to be.
Yeah, Dustin, if you could, it would be great if you could just walk us through the program, because I know there's things happening on Friday, things happening on Saturday. Yes. And if you could just start with Friday, what's going on, and then Saturday, what's going on. That will Friday, be
yeah, we're kicking it off for those who are the overachievers and want to come and get the most advanced level of muscle testing possible. Dr. V is going to be workshopping from 5 to 6, and probably longer than that, because I don't think we could ever wrap up anything in that amount of time.
5 to 6. Wait a minute. He's just going to get through his introductory comments.
So we'll see. We have 2 rooms where we're workshopping. So we'll see. Like I said, this is a living, breathing thing. We don't know exactly what's going to happen. But I intend to start a workshop on the heart sound recorder starting at 6 o'clock to show some direct live feedback on that. So you have options, right? So that we have some real time to get to know everybody and figure out what are the real questions that are coming. Because again, Dr. Crippen and I, all of us as speakers, know that we have great content, but if it's not what the people are coming to learn about, then it's not worth it. So we want to learn from them. What is it that you're coming here to learn, so that we can definitely shift and change and make sure that it's specifically appropriate to you at where you're at right now.
Yes.
And then the next morning, I get 4 hours where I get to lambast you with everything I can possibly give you in the shortest amount of time. Then Dr. Crippen is going to have some. I can't wait to see what he's put together, because I know that he meticulously does
Gonna
some
be great.
wonderful research.
Yep.
And then we do have an educator from the head of education for Integria is going to be there as well at the end of the day. And they're going to
Who's
do this
that?
15 minutes. I just met him through email, so I just got it all figured out. But
Oh, no.
I asked him to bring some cardiovascular innovations that they've discovered,
Okay.
specifically around apolipoprotein B, which is one
Oh.
that a lot of people are hearing about because of
Yep.
Peter Attia.
Protein
And,
portion of LDL.
Yes, and a lot of people don't really. It's being called one of the most important things for longevity, and I want us to know
Interesting.
what all of us have to offer for that right now. And I've been working on some things myself.
Yeah.
And then we have a panel discussion, the four of us and that individual as well. So
That's
it's going to
great.
be pretty awesome from top
Well,
to bottom.
Justin, I look forward to that because I'm pretty aware of apolipoprotein B. I don't even bother checking it because I haven't found it to be significant enough. So I look forward to learning about its significance. That's going to be great. So we have 2 workshops, and I love the workshop thing because, it's great to go hear a lecture, but to have like a hands-on, workshop with Dr. Verzal with muscle testing. And Scott, folks are going to be able to like do stuff. It's not just a lecture. It's a
Chiropractors are tactile learners, right?
That's right. Okay. Well, that's great.
So,
And then Dustin, you have an HSR. Okay. Well, that sounds wonderful. And Scott, anything else you want to say about your workshop on Friday?
well, as Dustin was talking about the program, it had me thinking, what if we did the HSR first, and then we could muscle test what shows up on the HSRs, prove
Wow.
things out, kind of bring it
Oh.
home for people. So just a concept of
Yeah.
as it's a dynamic environment. We
That's
also have some
right.
we also have some questions coming up on the side chat here too that
Yeah, we're going to
we may
cover
want to
those.
address.
That's great. Thank you, Scott. And Jeff, what are folks going to learn about in your session?
Yeah, I think I was just thinking as Dustin was talking, I think we're going to kind of marry like what's cutting edge with what's timelessly true. Like that's, I think, what we're going to kind of fit right there. Just
Yay.
like I think like what I just shared on the, Dustin's going to talk about coronary artery calcium scores, kind of a newer test becoming much more common, much more popular, and gives us some fantastic information. And the answer isn't, make a will or count the years till you die, but it's like, what can we do about it? And then I love that Roy Lee was talking about that 60 to 80 years ago on what the solution is and what the underlying cause is. And, to take Dr. V's philosophy, how can we turn that into advantage? What can we learn about that adaptive physiological mechanism the body's doing? And then how can we address it and create health through that? So I think that's kind of how we're going to bounce that between what's new, what's cutting edge, and then also what can we do about it, going back to, those first principles of health of what we know is true and what's been proven to help support cardiovascular health for years and decades and, over a century since it became much more common 100 years ago or so.
Excellent. That sounds great. And in keeping with Dr. V's point there will be no glyphosate served at this event. This will be a glyphosate-free Roundup event.
And even beyond that,
Dustin.
For those of you who are at Back to School for Doctors, Mark
Yes.
Anderson made a big deal about the chlorine in water, rendering a lot of vitamin B completely bad, right? You don't get any value from it. So this has been a big push. In fact, they're charging me still for the coffee that they're making and everything, but I'm bringing in my own water. That's the crazy water from Mineral Wells and my own beans.
Wow.
And so we're bringing in our own on top of that because we don't want to have anybody exposed to any of that nonsense.
Wow.
Right? But they're still charging us. But this is the game you got to play with them. But I'm definitely making sure that the quality of the water is top notch for everybody as well.
Yeah. Oh, that's fab. Wow. Amazing. So folks are going to get natural lithium containing water in the coffee. I mean,
everybody's going to be happy.
Amazing.
Caffeinated and happy. The seminar is going to be a hit from the first sip right there.
So folks, come for the coffee.
Yeah, right.
Stay for the muscle testing.
Stay for the That's awesome. And we have a great announcement for everybody. Strong Seminars has generously given all of our Gaeta Institute community a $50 discount on the tuition. So if folks, when they register, just put in my last name and it's Gaeta if you want the Italian pronunciation. And just put that in, and you'll get a $50 tuition discount. And I'll be honored to be part of that panel discussion. I will be there taking lots of notes from these incredible speakers, and I'll be offering a word or two in the panel discussion on Saturday afternoon. So anything else that any of you guys wanted to, oh, actually, first of all, before we do that, hang on, we've got some questions. And
well, I think I was just going to say, Richard's question was answered by Dr. Crippen in his presentations on GLP-1. And I think that he's very powerfully aware of all the damaging aspects of that, and he get a great detail on that when he taught it before. So I'm going to kick that one to Jeff to answer about the GLP-1 ramifications, as Richard puts it in there.
Yeah, Richard, both like Dustin's saying, thank you for the questions, because that was actually my first course I taught with Dr. Gaeta about actually a year ago this month.
That's
so
right.
I will answer that question just quickly if you'd like. I can go through just about 3 to 4 minutes, and we'll kind of and
this bears taking some time, because it's a big, the ramifications are,
it's important. Yeah, it's a big one.
And I was gonna say, do you mind if I share the screen?
You can,
Dr. Gaeta. Okay,
please do.
Awesome. And I'll pull this up and just go through a couple slides real quick. So why do we have side effects? I think I'll just start with this. GLP-1 that you naturally make in your body has a half-life between 1.5 and 5 minutes. In the body, in the injection, the half-life is 7 days, right? So we're having something that should be there for 90 seconds and turn it into, over 100 hours, right? So that's where these side effects come from. Couple things: 3.5% increase in the rate of intestinal obstruction. The reason you're not hungry is because your bowels are slowing down, right? And that's called intestinal obstruction. This is a fantastic one, actually. Dustin, I think you've sent me a study about this early on as I was preparing. So non-arthritic anterior ischemic optic neuropathy, the most common cause of sudden vision loss in people over 50 years old. As a reward for taking Ozempic, you get 181% increase in getting that. So it's sudden and irreversible blindness without treatment. It's actually, they're starting to talk about it more over the last 6 months to a year, but you definitely have, roughly 200% increase in sudden blindness, irreversible. This study was done 2018 to 2022. And that's actually something I should bring up, because the dosage of Ozempic for weight loss is about 2 to 5 times the dosage of that for type 2 diabetes. So this was done when the primary indication for it was type 2 diabetes, and it still is over in Europe. So this would say a minimum. I would say this is at least, I'd have good reason to expect it's a minimum of 2 to 5 times higher, the relative risk in those taking it for weight loss because of the increased dose. 30% go off the drug within 3 months, GI issues, and we'll jump to that in a second. So go ahead. I'm sorry, Dr. Gaeta.
No, that's a hint.
Yeah, exactly.
On the visual aspect, one of the common supplements I find these people need is Vitanox. Seems like it'd be a nice way to kind of prevent some of the visual disturbance that would go along with it.
Sure. Yeah, I think that makes a lot of sense with that effect on the eye health. Yeah, that is awesome. And then nine times greater risk of pancreatitis. This study says 4.22 times greater risk of bowel obstruction compared to 3.5. But what's interesting about this is sourced from the largest study I've ever seen on GLP-1s, and one of the largest studies ever, 16 million medical records, right? So this is pretty exhaustive. 3.6 times greater risk of gastroparesis, which is basically stomach paralysis if we decide not to speak Greek. And a 1.48 times greater risk of biliary disease, such as gallstones. Couple that with glyphosate and you're really in trouble. Novo Nordisk lists thyroid cancer as a possible warrants against the use in individuals with medullary thyroid carcinoma. Here's all the studies. This is actually the STEP 5 trial, one of the largest ones. Key takeaway: 96.1% of all participants experienced an adverse effect, which means, the math equals roughly everyone, right, is having some kind of issues. Most common ones were GI in nature. And this is, I can go more, but this is probably the last, maybe I'll go one more after this. But this is something I really want to highlight. This connects to the work you've done, Dustin, on mental health. But 45% increased risk of suicidal ideation in those taking Ozempic.
Wow.
Right? Which is
That's
striking.
messed up.
That's
Wow.
striking. But wait, it's worse, right? And the risk of suicidal ideation jumps 350% who are already taking SSRIs. And we mentioned this on an earlier Mondays with Michael with you, but to bring that back up, I mean, I think that's a really powerful idea. And the EU has launched a probe into it. I haven't heard much at all about that in the United States, but the EU is searching that right now. And then we kind of talk about possible mechanisms, but nutrient depletion is certainly one. And I think a key thing is from our friend Hippocrates, who reminded us that all disease begins in the gut, and specifically 95% of all serotonin production begins in the gut, and SSRIs are selective serotonin uptake inhibitors. And the final one I'll share is, there's definite weight loss with them. But the question is it fat loss or is it muscle loss? 20 to 40% of the weight loss with GLP-1 agonists is muscle loss. And the step one in Sustain A2 of the larger trials found 39 to 40% of the weight loss was lean mass.
Yikes.
So
Ozempic phase.
Yeah, exactly. Yeah.
Wow.
Let me see if I can quickly find Ozempic face for you. But that's it. It's the saggy.
That's amazing.
Yep. Here's Ozempic face for you. Hollowed out appearance, increased signs of aging, such as lines and wrinkles, loss of fat, loose skin becoming loose. Yep, exactly. Yeah. And since breasts are largely fat as well, a similar effect can happen there, which is many women report that with it as well. So yeah, so there's a short overview for you, Richard, of it. And
thank you.
There's another 6 to 8 hours from Dr. Gaeta and I
for sure.
on that as well, if you'd like.
Yeah. And Richard, I really encourage you to take Dr. Crippen's course, or encourage all of you to take Dr. Crippen's course, get a discount, MWM10. It's an amazing course. The reviews were incredible. And what people learned is not just about Ozempic, but how to just have healthy blood sugar and healthy weight. So it's really an everybody course, regardless of if you're considering taking one of these super nasty drugs or not. All right. Thank you, Jeff. So we have another question. This is a clinical question from one of our practitioners. I have a 75-year-old lady with stable systolic pressure, 150 to 160, diastolic climbing, now in the upper 80s, on liver support, vascular support, also on losartan for many years, and amlodipine for 6 months. So we'll just popcorn this. You guys can jump in if you like, as you wish.
Well, my first question would be, is there a change happening with losartan and amlodipine, right? I always want that person to take their blood pressure before they take their medications, always, and seeing what it's doing. And if it is, then again, we can learn from it, right? Amlodipine is a calcium channel blocker. So then we have to look at what's going on with calcium in the body. What are the other things that they could be missing? Usually magnesium is at the top of my list for individuals like that who are having an issue with that. Losartan would be an angiotensin II receptor blocker. So the top three things that I'm looking at in all of these cases to rule out first is the omega-3s. And if she's in her 70s, we want to make sure she's digesting and utilizing the fats. That's probably a big piece of it. Cod liver oil is one of my tops for this, for sure. I like Chelaco for individuals of that age because it gives you the hawthorn being that nurse for the geriatric heart. And there's garlic in there as well. And garlic alone has been shown to reduce both of those numbers, up to 5 points very quickly for that individual. But yeah, and again, I would get information from whether or not those medications are working. But I would look at garlic, I'd look at Chelaco, I'd look at the omega-3 fatty acids and magnesium. Those are the top three. But I'd be remiss if I didn't mention potassium as well. And also look at what you're losing taking those medications, right? Losartan is costing you potassium. It's costing you micronutrients. And so you definitely have to figure out what are all the nutrients that these medications are missing and balance for that. And then probably have to go beyond just balancing for that because it was probably a lack of those nutrients in the first place that got her to where she needs to be. That's my take on it.
Excellent.
Anyone else want to add to that? Dr. V?
Well done. I mean, you nailed it. I was going to go with magnesium as well, just to help lower. I mean, my first thought there would have been high serotonin. So we want to look at, again, sulfation helping metabolize. Magnesium helps convert serotonin to melatonin. So if, she's got sleep issues or bowel issues, further confirmation that magnesium deficiency is there, and what percentage of the population is magnesium deficient, right? Most of them. So, yeah. So Dustin, great answer. Again, just reinforcing the whole magnesium pursuit.
Yeah, and I second that as well. I mean, great job, Dustin there. And I'm always curious, when exactly did it begin, right? I'm curious about the point somebody went from having normal blood pressure to having high blood pressure. Just a simple rule I have is every effect has a cause. So what's underlying that? And then we're working backwards. Did they recently start eating 2 bowls of glyphosate-loaded Honey Nut Cheerios a day, right? In that case, we can look at gallbladder, we can look at beets, we can look at nitric oxide. Was there a stressful event in their life? And then we're looking at things more that calm the brain, nervous system, HPA axis, right? What can we work through? What can we learn from their history? If there is a key change point they can identify that can guide us towards liver or heart or cardiovascular or nitric oxide or kidney, and kind of point us down one of those directions. And that, that anyway, that would connect with what you were saying, Dr. V, about the serotonin as well, possibly with some of that. So anyway, that was what I would add, is just a good history. When did it begin? What can we learn from that change point? And can that guide our clinical reasoning, decision making around that?
Excellent.
So Friday night, we're going to get into ways to muscle test everything Dr. Jeff just said.
Okay.
So, there's points for nitric oxide, there's points for calcium, acetylcholine, heart muscle, valves, all that sort of stuff. So we'll dive in on Friday night.
Fabulous. So make sure you're there for that Friday night workshop with Dr. Verzal and Dustin Strong on the heart sound recorder, formerly known as the endocardiograph. It's the digital endocardiograph. And Dr. Verzal on muscle testing. And looks like we have one more question. This is for Dustin. Will Dustin be speaking about lithium orotate more in depth at this seminar in relationship to cardiovascular and other issues?
It's not currently in my slide deck for this because there's a lot of other information, but I'm more than happy to have conversations on the side about that, and definitely can talk about it in the panel discussion. And I'll see where I can weave it in throughout, where maybe I should have and I haven't yet. Specifically, I mean, lithium in the past, I've thought more about cognitive function and longevity, but I'm sure there are some connections I can make with cardiometabolic for sure.
And you'll make sure they drink it.
Yes.
And you'll be drinking it.
And your coffee.
Come for the crazy water. Come for the crazy water.
Day for the muscle testing.
That's right. So the long answer to your question there, this is from Amy. She is a functional medicine nurse and a graduate of our functional medicine program, and she is in Nebraska. We have a whole course on the answer to your question called Mind Mineral Mastery, which is a brilliant course all about lithium. So it's the definitive course on lithium in brain health and beyond. So I encourage you to take that course. It was excellent with Dustin Strong. All right. Well, that's our questions. I'm just going to ask you, gents, any final comments to feel complete for today? And we will start with Dr. Crippen.
I just appreciate the invitation, Dr. Gaeta. I'm excited that the 4 of us will be getting together again in a few weeks, and just
fans getting together.
Yeah, exactly. And just excited to just like to invite you guys to join us in Dallas in just under 3 weeks for this event, where, as you can tell, Dustin's put a lot of thought and time into this. He's been to a lot of seminars, he's taught a lot of seminars, and put a lot of thought in how to communicate the information in the best way and set it up for you to have the best experience as an attendee as possible. So we're really excited if you guys decide to join us, pilot this with us, give us the feedback, and help Dustin create 3 more awesome events later this year. So anyway, look forward to seeing you, Dr. Gaeta, Dr. V, in person, and obviously Dustin as well in a few weeks, and look forward to meeting some of your listeners in person as well.
Thank you, Dr. Jeff Crippen. Dr. Scott Verzal, final comments. Anything to feel complete for today?
Yeah, you can't go wrong. Rubbing shoulders with a bunch of brilliant docs. Getting together with our peers. We don't. I'm just pointing to myself. I don't do enough of that. I tend to function as a lone ranger, trailblazer. So it'd be great to get together with everybody and just share thoughts, because I mean the bullet points are going to be flying for whatever it's going to be, 16 hours, the take homes are going to be profound. And I mean, how could your practice not grow if we keep people alive, right?
That's right. Thank you, Scott. Excellent. And final comments from Dustin Strong.
Well, I appreciate what Dr. Crippen just said. Absolutely. This is something that's a living, breathing thing. So the more we can get your feedback on what makes it the best experience, the better we can make it a better experience in the future. So that's really what it is. This is a team effort, and we don't want it just to be the same old thing where somebody just gets up and presents and we all go home. We want it to be seeing each other's blind spots, helping each other become better. And Dr. V just said, that time together is invaluable, right? You just can't replace that at all. I made the mistake myself of coming into a health challenge I had this week because this mountain cedar is off the charts in Texas. And I didn't have somebody like me to look at me and say, hey, dummy, do this, right? It took me 3 days before I went, oh my gosh, I'm clearly low or I'm out of balance with my pH. And I started honking down the Cal-Ammo and I'm totally fine, right? But we need each other to see each other, and keep each other sharp and healthy as well. So.
Excellent. Well, excellent. We have done it. Thank you, gentlemen. Look forward to seeing all of you in less than 3 weeks. We're going to have a great time. It's going to be a fabulous event. Dustin, thank you for creating this event and bringing such great teachers together in the form of Doctors Crippen and Versal, and your teaching as well. I really look forward to it. I will have a laptop at the ready to take lots of notes because I know I'm going to learn a lot from all three of you. And I really encourage folks, wherever you are, it is very worth the trip. I'm all booked for my ticket and my flight and my hotel and looking forward to being there. And it's right near Dustin, right? DFW Airport is nearby.
Very close ride. Yes.
So super easy to get to, one of the biggest airports in the world. So it's easy to get to from wherever you are. And so please join us in Dallas, January 31st. Gentlemen, thank you so much for being with us, for being part of our faculty. We are honored to have you be part of our Gaeta Institute faculty. I know our students love your courses and will love your upcoming courses as well. So thank you, gentlemen.
Thank you. Have a great one, guys.
Bye.
All right. Well, that was fabulous. So we're going to move on to our final section of our show today. We've got some awesome updates, and I look forward to seeing again all of you in Dallas at the end of the month. And let's see. So a couple of things. The Dr. Versal spoke about glyphosate and wanted to just share with you a study or two on that exact subject. And I'll get this into the chat on our watch page and also on our Zoom link. So just to wrap up that section, there's a bit I wanted to share on that. And just to give you some, like, what is he talking about kind of data. This was published 10 years ago in Surgery Neurology International. Sure, you all have a long-standing subscription to Surgery Neurology International. And this is Glyphosate Pathways to Modern Diseases 3. So that means there's two others. I just came across this one. And this is the headline here, Disruption of Bile Acid Homeostasis. And so that's the connection, one of them, between glyphosate and gallbladder problems. This other paper was related, and I'll give you the link for that as well. There it is. And this is called Heavy Metals, Halogenated Hydrocarbons, Phthalates, Glyphosate, Cordyceps, Alcohol, Drugs, and Herbs, assessed for liver injury and mechanistic steps. So this this paper also talks about damage to the liver and gallbladder from glyphosate. So you've got a couple of references there. This was it's a full text study, which is great. This was, let's see, yeah. So anyway, there's that paper as well. Okay, so you've got that. And also just a reminder, we have all of Dustin Strong's courses in one convenient spot on his faculty page. And so I'm just going to give you the link to that again. Dustin Strong, he has several courses that he has taught for us are right here. And I encourage you to take advantage of that. A lot on mental health. Dustin's kind of our mental health expert. He's had so much clinical experience helping people with mind, mood, and memory. And so we have his ultimate mental health protocol, which I contributed to as well. Mind Mineral Mastery, all about lithium and mastering brain vitality. So you have 3 courses on mental health. Alzheimer's disease, number 6 cause of death in the United States. We know it's related to malnutrition. We know it's related to aluminum. We know it's related to a bunch of things, vaccines and so forth. And we talk about that in depth. So please enjoy those courses and a discount, MWM10. So that is Dustin Strong's faculty page. And if you missed it, we also have Dr. Crippen, his faculty page as well, which is going to grow because he's teaching a brand new course for us, a companion course with updates to his amazing book, Timeless Youth. Next, we're going to get into, and I'll give you a link to that. I was happy to make contributions to that course as well. And so this is his one course for us, soon to be 2. Beyond Ozempic, what a great course. Just really enjoyed that course. I learned a lot. As you can see, as you saw today, Jeff, it makes great slides, great research, all the things I aspire to. He's really has dialed in. So enjoy those courses. All right, up next, we have some absolutely astounding MAHA updates. And so I'm going to just suit up here for the MAHA updates with my MAHA cap, Make America Healthy Again cap. And it's just sort of a strange thing. I live in kind of wacky town, Boulder, Colorado, but very health conscious. And it's just sort of bizarre to me living here how somehow, some weird way, that being healthy somehow became political. I just don't understand that at all. Like, how is being healthy a political thing? It's not. It's a human health thing, And so I don't fully understand that. But anyway, some people have decided to make healthy children and adults a political issue for the first time, like ever. But anyway, kind of wacky. But anyway, some remarkable developments, totally stunning. And we just talked about this last week. And so just in the past week, some absolutely incredible developments in the MAHA, Make America Healthy Again movement. Bobby, in his when he became part of the president's team, what he promised was observable improvements in 2 years. And with the changes that have already been made, we went over the whole last year, like the year 1, were astounding, focused on food. And now year 2, he's getting into the vaccines. And so I'm quite confident he's going to deliver on that. I'm pretty sure we're going to see stats, data, evidence of incredible changes in American health a year from now. I'm very confident about that because of the moves that Bobby is making. Of course, drawing the ire of pharma and their minions in the mainstream media and in the medical associations as well, especially American Academy of Pediatrics, which is trying to portray Bobby as some kind of, Darth Vader type villain, particularly after he cut their funding. That was awesome. Anyway, so let's look at a couple of updates that are just massive. So first one isn't a MAHA update, but kind of sad, but we got to be sober and honest about what's happening with these COVID shots. I just had another new patient, sadly. Wish I didn't, honestly. This was a lady who had 5 COVID shots and developed a very quickly, like very healthy lady, no family history, no past medical history. And sadly, after 5 COVID shots, developed a very aggressive type of cancer. And so this is from the awesome Nick Hulsher. Highly recommend following Nick on X, which is mostly, not entirely, a free speech platform. And the McCullough Foundation, actually published in Science, Public Health Policy and Law. That's a journal of my friend James Lyons Weiler. We published the largest COVID jab autopsy study ever conducted and found that 73.9, so 74% of all deaths after COVID, the genocide jab, the murder weapon, the poison death shot, 74% of all deaths were caused by the shot, mostly within a week. From multi-organ failure, sudden cardiac death, pulmonary embolism, and stroke. Wow, that is just crazy town. So I'm going to give you the link to the study so you can get the original text. And it's, I believe it is full text. I'll get this over to the watch page as well. And wow, that's just bad news. So you got to share this stuff. We talk about this most weeks about the genocide jab, working perfectly, by the way. This is exactly what it was designed to do. Was to kill a lot of people, cause a lot of miscarriages, and cause a lot of infertility. And that's what they do. You know, the conservative estimate is 20 million dead globally just from the COVID shots. That's a very low estimate. My guess, just my opinion, it's probably 10 times that worldwide. So it's astounding. So that was the first thing I wanted to mention today. Then we're going to get into our MAHA updates next. Great news. So here's the first one. This is a short video from the pediatric neurosurgeon, one of the top pediatric neurosurgeons ever, which is Dr. Ben Carson. And this is, actually, no, we got a lead into this. Sorry, we got to do a lead in on that one. Here it is. Okay, this was the big news here. So this was the new food pyramid basically got flipped upside down. And you'll see it here. Let's listen to Bobby. Did a extensive press tour showing up all over news shows and such to talk about this. So let's hear Bobby. There's a lot of excerpts on the food pyramid, caused quite a hubbub, but let's listen to just a short little one.
And if you want to have a soda pop and a donut, that's up to you. We live in America. You ought to be able to make those choices. But we are moving right now to move to front of product labeling, or we're going to tell people exactly what's in their food and why, whether it's good for them or bad for them, and let them make healthy choices. And move to front of.
Here's the. Let me see if I can get a better shot of this. The food pyramid itself it's not perfect. You know, Dr. McCullough gave it a B, but it's much better than the crazy town pyramid we had before, which was mostly grains. So you basically flip the food pyramid over. It's the opposite of what we had before, which is a very good thing. So I got a better shot of it for you. This is a huge development, massive. Is it perfect? No, but is it better? A lot. It's amazing. There's a new website, realfood.gov. And basically, Bobby, again, based on science, evidence, data, statistics, came up with a pyramid which is literally the opposite of what we had before. And right at the top of the new food pyramid is meat and healthy fats and vegetables and fruits. So you see at the very bottom, eat this the least, or the grains. And then we have fruits, vegetables, meats, fats, and dairy way up as primary food. So let's look a little more detail at this. So we are ending the war on protein. And they recommend this protein target will give will reliably induce seizure activity in any vegan, because they've been told that protein is bad and they hardly need any protein in their diet. You don't need protein. You just need carbohydrates from fruits and vegetables. So the protein target, to put this in imperial system terms, is at least half a gram per pound of body weight. So say a 150-pound person would be consuming, this is what I've recommended for decades, is a gram per 2 pounds, or at least half a gram per pound minimum, and ideally more than that. So the government just massively increased the protein target for everybody. And 1.6 grams per kilogram is even more. A kilogram is 2.2 pounds. So we can do the math on that. Yeah, so that's 0.72, basically 0.7 grams of protein per pound is on the upper limit. And that goes up easily based on level of physical activity. In my own practice as a dietitian, nutritionist, often have patients who are very physically active, doing weight-bearing exercise, many times per week, and I'm often recommending they get closer to a gram per pound of protein. Power lifters, like the really serious folks that, so male power lifters who are, all about mass, easily consume 200 grams of protein per day. Also, the famous story, the greatest Olympian swimmer, why am I blanking? Michael Phelps, ate 12,000 calories a day when training for the Olympics, where he won an unprecedented 8 gold medals, which you can't really achieve in any other sport other than swimming. Typically, you get 1 or 2 at most, but swimming is just set up that way. But anyway, full fat diet. So full fat diet, getting rid of this low fat, fat-free nonsense, and going full fat, full protein, and they are investing $50 billion. That's an average of $1 billion per state on average, to sustainable, organic, regenerative agriculture, which is incredible. As Bobby said in his campaign, the way you improve human health, you start with the health of the soil. He said, if you fix the soil, you'll fix the health. You'll fix the health. And so they're going all in. They're putting heavy resources into regenerative agriculture, which is incredible. And so this is the big news, is plenty of protein, full fat, avoid all this low fat garbage that's been a disaster because we've replaced that fat with sugar. Because fat is flavorful. That's why I like my ribeye, has the most fat. So nutrient-dense protein and a full-fat diet. Next, fruits and vegetables. Now, this has come down a bit. The previous recommendation was somewhere between 7 and 11 or 7 and 9 servings a day. So there's that. Again, this is number 2 category, fruits and vegetables, after the protein and full fat diet. Then we have fruits and vegetables, yay. So a total of 5 servings per day, far beyond. I mean, I've looked at thousands and thousands and thousands of 7-day food diaries from patients over the last 35 years. And, the average person is not eating anywhere near that on average when they come in. And, I'm seeing not even the average person, but folks who are already a little more health conscious. Then at the bottom, we've got some whole grains, avoiding refined white flour, for example. And that is at the bottom, the lowest thing on the pyramid. So, and this, this has a role to play because the body, again, the carnivore crowd will disagree with me on this. That's okay. But the carnivore diet, the one concern is that there's literally no fiber to be found anywhere. It's almost a fiber-free diet because there's not really much fiber at all in meat. So not dissing that diet, it can be astoundingly helpful as a therapeutic diet. But in my own practice anyway, I do recommend folks do eat some fruits, vegetables, and whole grains, in part to get that colorful diet going, but also, and the range of benefits from fruit and vegetable compounds. I mean, we have thousands of studies on this. This is not my opinion. And the importance of fiber to the gut microbiome. My concern, again, I haven't seen any studies on this, so it may not be true at all. But my concern is starving the microbiome with a fiber-free diet. So, but anyway, this food pyramid is excellent, really excellent. And so really a massive upgrade over the previous pyramid, which was a complete disaster and emphasized, grains, the main thing. So South Park managed to jump in on this, which is, they go kind of a little too far sometimes on their humor, but this one was a gem, a real gem. So let's listen to South Park reporting on the how the government scientists came upon the new food pyramid. Here we go. It's very good.
The pyramid doesn't work. We've already tried it.
It's upside down.
What?
So that's Bobby Kennedy. He's talking to Bobby Kennedy. And they even approximated his flu vaccine injured voice.
The pyramid doesn't work. We've already tried it.
It's upside down.
What?
Sir, the pyramid is upside down.
Turn the pyramid upside down. You can't be serious. That would put butter and fat at the top of the damn food pyramid! Get the president on the phone. Tell him to have some steak with his butter. The pyramid doesn't work. We've already tried it.
Oh, that's great.
Upside down.
Turn the pyramid upside down. You can't be serious. That would put butter and fat at the top of the damn food pyramid! Get the president on the phone. Tell him to have some steak with his butter.
What if you caught the end? He said, get the president on the phone. Tell him to have some steak with his butter. Anyway, great news. Just fabulous and very positive. Let me give you the let me give you the link to that video from South Park. Really good. And there it is. And you'll find all these updates on the Secretary Kennedy page, where you'll find some of these updates anyway. So big news on that, only to be surpassed. I mean, that's huge, and at least as big. At least as big. And for some of us, we never thought we'd see the day. the vaccine schedule has been massively reduced, which is, just something that for a long time, we never really thought even was possible, because it's only grown from one smallpox over a century ago, starting basically 150 years ago, to 79 or 94, depending on which schedule you're following and the age of the person. So this is super massive. You'll find details of this. I'll give you the link at Maha Action on X. That's a good place to go for stuff, is Maha Action on X. And I said it's mostly a free speech platform. It's not entirely. There is still some censorship on this platform, but it's much, much less. Certainly preferable to any other platform, and literally a saved free speech. So all the vaccines are still available. And Bobby even said that in his campaign. He said, we're not going to take anybody's vaccines away, but we are going to look at the recommended schedule. And basically what happened is the ultra corrupt CDC, until recently, and for decades, ultra corrupt CDC, brought pharma operatives and doctors and scientists on pharma payroll into the ACIP, the Advisory Council on Immunization Practices, to come up with the vaccine schedule. And not once did they make it smaller. And Bobby's point has always been, hey, wait a minute. In Europe, they give a lot less vaccines. The kids are healthier. They have no epidemics of any of these vaccinated diseases that they don't vaccinate for in Europe, like chickenpox, typically, which is an absurd vaccine. It's a 1-week rash, basically like measles, which has therapeutic benefits as well for detoxification and immune activation in a healthy way. And why don't we do what Europe does? Like, are the European scientists stupid? Was Bobby's basic point. Like, do we know something they don't? And so they looked at outcomes. They consulted with scientists and public health guys and physicians over there in Europe. And they're like, no, there's no scientific evidence basis for the size of vaccine schedule that we have. And so they reduced it a lot. And so it's one estimate has it at 50 fewer doses. If you follow the new recommendations, the number of recommended vaccines is dramatically reduced. So this is just massive, massive news on this reduction in the size of the recommended schedule. So that was that. I'll refer you to the awesome Aaron Seary for his commentary on this, and he explains in some detail the ramifications of the new schedule. So I'll get that. It's now in the chat for you. But if you take a quick tour of Aaron Seary, the super lawyer who's dispelling the the vaccine cult, and wrote a book on that subject, Vaccines, Amen, which is what I've been talking about for decades, is that the vaccine program is a cult. However you define a cult, it meets those requirements. And so he talks about, does it remove the liability shield from 1986? He explains that. And just goes through all of that detail. Also, getting fluoride out of the water was another huge, huge thing. The government is now recommending to all municipalities in the country to get fluoride out of the toothpaste. And the Texas Attorney General, the awesome Ken Paxton, got Crest and other vaccine toothpaste manufacturers to reduce the serving suggestion, which is this massive, glob of toothpaste, to just a little dot to reduce fluoride exposure through toothpaste. So this is going to really make a difference in getting less fluoride. They're taking mercury out of the vaccines as a preservative. Aluminum needs to be next. That's going to be at least as important. But we have a smaller vaccine schedule in line with other countries. Now, ideally, the recommended vaccine schedule will be 0 and let folks do what they want. But this is certainly a step in the right direction. Here's a good one. The U.S. schedule, 72 injections. In Europe, 11. And they have much healthier kids on every metric. So that is pretty significant. And here is the press release on this subject from HHS. And so you can see exactly what changed in the vaccine schedule. This is great because this, again, as I pointed out, for decades, this is the greatest cause of childhood illness. The vaccine schedule is easily, by far, it's not even close, the greatest source of childhood illness and disease. And so to have that at least less is a big deal. So pretty remarkable development there. So there it is. And that is our MAHA update. And we have done it for today. I'm just going to take questions now. Richard had a question with the health implication of taking stem cells, not from urine fat, taking tissues, birth. Okay, yeah. Well, I've had stem cell injections in my left knee to help regenerate my injury, to help heal the injuries with regenerative orthopedics rather than surgery. And it may have been successful until I re-injured it in October in karate class. I did the one thing because I just forgot and was feeling good, so I just kind of messed up. Did the one thing the physical therapist said not to do, and my knee, buckled, collapsed, completely ruptured my ACL, and I need surgery. But prior to that dumb move in October, I believe the regenerative approach with stem cells, platelets, and prolotherapy was successful. The knee definitely was more stable, for sure, 100%. So anyway, so that's what I've done, but I know people are taking stem cells for a variety of reasons. And I'm, not entirely, I can't speak to every stem cell approach that exists anywhere. But I think the general approach is potentially sound in that, you're aiding in the body's own regeneration, which can work if you have the right nutrition to form those tissues and cells that you're looking to regenerate or heal. So the Reardon approach uses umbilical cord tissue-derived mesenchymal stem cells. And mesenchymal stem cells can become a lot of different things. They're made by the pericytes, P-E-R-I, parasites, which in part line our blood vessels, especially the capillaries. And that's just one example of stem cell therapy. So I think, my approach is in the spectrum of nature first, drugs last. It's way in the direction of drugs last. But if it reduces use of surgery, if it reduces use of pharmaceuticals, it's a good thing. I think it was most likely safer and better, more benevolent than pharma drugs and surgeries, neither of which are bad, but if you can avoid them, that's better. So, that would be my take on it in general, not speaking about any individual treatment. But as I said, I went that approach myself to try to avoid surgery. And I think I would have avoided surgery if I hadn't re-injured if I had not re-injured my knee. So I will be going in for surgery at some point, and just have to kind of be careful, until then, since I have kind of no ACL plus a shredded meniscus and missing cartilage. It's pretty, it's pretty advanced, devastation in the knee. So anyway, last clip, and then we're done for today. I'm going to play you some music if you want to stick around. Taking requests, if you want classical, original, jazz, or liturgical, you can put your requests in the chat. But a final video. This is from Dr. Marty Makary, who amazingly stated that Lyme disease was a bioweapon made in a CIA bioweapons lab a couple of miles from Lyme, Connecticut, kind of like Wuhan, the epicenter where they made SARS-CoV-2, or they finished it. They started building it in North Carolina, University of North Carolina, Chapel Hill, the CIA bioweapons lab there. And then Fauci exported the SARS-CoV-2 project and finished it in Wuhan. And then the first cases were right nearby and reported. And same thing, apparently, according to Marty Makary, the head of FDA, that Lyme disease was the same thing. That was astounding, because somebody asked Bobby that on the campaign trail, and he kind of sidestepped it a bit and said, well, somebody gave me a few books on it. I have to read up on it and this and that. I think he kind of, maybe knew that Lyme disease was a government bioweapon, just like SARS-CoV-2, or, what behind the COVID situation. Well, anyway, final clip for today. This is Marty Makary. Predictably, the Marxist, socialist, totalitarian dictator of California, who's completely destroyed the state after destroying San Francisco as mayor, Gavin Newsom. Governor Newsom, of course, as a pharma operative in some way, at least ideologically, criticized the reduction in vaccine schedule, which all medical associations did, of course. AAP, American Academy of Pediatrics, just basically shrieking at the top of their lungs, especially since this followed immediately. They're getting their government assistance, welfare cut. Bobby stopped funding the AAP, which was just so great. Anyway, let's listen to Marty Makary. This will be our last clip for today, and then I'll play something on the piano.
California Governor Gavin Newsom, who's blasting the new vaccine schedule, as are others. And he's saying that it endangers the lives of babies out there. He said this reckless move by the Trump administration has nothing to do with science or informed choice. It's about appeasing a debunked anti-vaccine agenda being pushed by RFK Jr. and his allies. Respond to that.
Well, look, unfortunately, you're going to hear this partisan rhetoric. I would tell him, where are these mass outbreaks in Denmark and parts of Europe? This new core essential vaccine list, which is not saying we're going to only recommend these core essential vaccines, it's just giving parents a hierarchy of vaccines, because not all vaccines are created equal. We're trying to increase vaccine uptake among children by identifying a list of core essential vaccines that are the most important. It's about 30-some shots in one's childhood as opposed to 72. 30-some is better than zero. We don't want people at zero. We've seen vaccination rates in children go down in the Biden years because of the dogma of ignoring natural immunity and cloth masks on toddlers for 3 years and shutting kids out of school. A lot of dogma resulted in a loss of public health trust. We're trying to rebuild that trust, and we're giving parents a hierarchy of vaccines. We're still recommending all the vaccines. They're still all covered, but we're giving them a hierarchy to say these are the core essential vaccines.
Okay.
Well, there you go. So it's a step. it's a step. Ideally, we wouldn't have any recommended vaccines,
California
but
Governor
and
Gaeta
just let
just-
people decide what they want to decide for their kids. Predictably, the vaccine cult and its operatives in elected officials, in pharma, in medical associations, in the mainstream media, which gets 60 to 70% of its total revenues from pharma ads. That's starting to change as well this year. We're going to see a curtailment of pharma advertising, I hope, on the way to a complete banning of pharma ads on direct to the public, what they call DTC ads, direct to consumer advertising. But it's a step. It's a step, and it's a good step. And it's simply, this is exactly what Bobby talked about in his campaign, putting our recommended schedule in line with Europe. And the first thing Dr. Makary said was, there's no epidemics in Europe with a smaller schedule. And the kids are healthier, of course. The less vaccines a kid gets, this is not opinion. This is even the ultra pro vaccine Henry Ford health system confirmed in their own research that the healthiest children in America have received 0 vaccines. And the sickest children in America, again, not my opinion, this is data, evidence, statistics from an ultra pro vaccine health system, one of the largest in the world, confirmed that the sickest children on Earth, or at least in the US, but by extension on Earth, are fully vaccinated American kids. So the truth's coming out, folks, and hallelujah to that, because I look forward to the day when, in my own practice, there's no more vaccine injured kids. I've treated too many vaccine injured kids to it's just total devastation. And you don't see, Bobby talked about this in his campaign, you don't see in the statistics the human tragedy of families destroyed. They looked at divorce rates in autistic kid families is much higher because of the incredible emotional strain, psychological strain, everything strain it puts on the family. Again, caused by the vaccine cult. Not the only cause, but the main cause. And this is, again, not my opinion at this point. It's just data. Vaccines cause autism in some kids. It's not the only cause, but it's the main cause. So anyway, an amazing week. I mean, it's been an amazing week. So super thankful to Bobby Kennedy, Marty Makary, Jay Bhattacharya, and just for their efforts. Brooke Rollins, cleaning up the food. It's just a pretty amazing thing. This is all on top of all the Maha wins of 2025. So this year is going to prove to be completely awesome, and really looking forward to it. And as I said on Facebook a few days ago, I look forward to a day when all my patients are coming in for wellness care. Hey, I'm real healthy, just want to do some fine tuning and prevention. Wellness care, preventative care. Instead of having like almost my whole practice be super sick people with a lot of chronic disease. I look forward to just doing wellness care for everybody, and it's happening. It's happening. These moves from last year and already in the first 2 weeks of this year will definitely, absolutely 100% result in a healthier population, starting with healthier kids. Brooke Rollins working on getting healthy food into the school lunch programs, so we're not poisoning our kids every time they go to school. A lot of good change. And our military, who should be eating like pristine, awesome food all day, they're getting better food. Now the whole country is going to start eating better with the new pyramid. It's really great news. So thanks to everybody for being here. Blessings to you and yours. We will see you next week. And I'm going to play you something. All right. Take care, everybody. Have a great week. This is the last time you're going to see this year's tree. Kids come back tomorrow. And we're going to take all the holiday decorations down. So enjoy the tree one last time. And then next week, you'll see just the usual photos in that spot. All right. Take care, everybody. Blessings to all. Take care. We'll see you in Dallas at the end of this month as well. All right. And the dog will be back next week, too. Okay. Okay, that was Place in This World. Michael Smith, the number 6 in the top 40 hit from 1991. And thanks, everybody. Blessings to all. And